Hello everyone, in continuation to our previous lecture on the basic concept of the drug design, today we are going to discuss about the pharmacokinetic parameters in the drug design. As we have already discussed that the compound with the best binding interaction is not necessarily the best drug to use in the medicine. The drug needs to pass through many barriers to reach its target in the body. There are many ways to make the drug to reach its target, such as linking the drug to polymers or antibodies or encapsulating it within a polymeric carrier. Thus, the aim is to develop a drug that will be absorbed into the blood supply and will reach their target efficiently and be stable enough to survive the journey and will be eliminated in a reasonable period of time. In short, all of these processes are known as ADME, that is the absorption, distribution, metabolism and elimination. In other words, designing a drug with optimum pharmacokinetics can be achieved by different strategies. So now let's discuss different strategies one by one. First is the improvement of absorption. Drug absorption is determined by its hydrophilic or its hydrophobic properties, which depends upon the polarity and ionization of the drug. The drugs which are too polar or strongly ionized do not easily cross the cell membrane of the gut wall. Therefore, they are given by injection. But the disadvantage that they are quickly excreted from the body. If we talk about the drugs which are non-polar, on the other hand, are poorly soluble in aqueous solution and are poorly absorbed. If they are given by injection, they are taken up by the fat tissue. In general, the polarity and the ionization of compounds can be altered by changing their substituents, and these changes are known as quantitative structure activity relationships, that is the QSAR. The QSAR approach attempts to identify and quantify the physiochemical properties of drug and to see whether any of these properties has an effect on the drug's biological activity by using a mathematical equation. Physicochemical properties explored using QSAR are the hydrophobicity of the molecule or the substituent, the electronic properties and the steric properties of the substituents. Now, what are the strategies to improve the absorption? The first and important strategy is variation of alkyl or acyl substituents to vary the polarity. In case A, the molecules can be made less polar by masking a polar functional group with an alkyl or the acyl group. For example, an alcohol or phenols can be converted to ester or amide. Primary and secondary amines can be converted to amides or the secondary or tertiary amines. In case B, the polarity is decreased not only by masking the polar groups but by addition of an extra hydrophobic alkyl group. The large alkyl groups having a greater hydrophobic effect. But we have to be very careful in masking the polar groups because they are very important in binding the drug to its target, as masking them may prevent the binding. Extra alkyl groups can be added to the carbon skeleton directly or may involve more synthesis. If the molecule is not sufficiently polar, then the opposite strategy can be used, that is replacing the large alkyl groups with the smaller alkyl groups or removing them entirely from the structure. Now the second strategy is varying the polar functional groups to vary the polarity. A polar functional group could be added to a drug to increase the polarity. For example, the Ticonazole, it is an antifungal drug and it is used only for the skin infections because it is non-polar and it is poorly absorbed in the blood. But by introducing a polar hydroxy group and a more polar heterocyclic ring led to the orally active antifungal drug which is known as Fluconazole. So this is the Ticonazole, which is less polar, but we have to increase the polarity. So we have substituted this OH group and we have substituted a polar triazole ring in the structure. In contrast, the polarity of an excessively polar drug could be lowered by removing the polar functional groups. Now coming to the variations of N-alkyl substituents to vary the pKa. Drugs with a pKa outside the range of 6 to 9 tends to be too strongly ionized and are poorly absorbed through the cell membrane. The pKa can often be altered to bring it into the preferred range. For example, the pKa of an amine can be altered by varying the alkyl substituents. In general, the electron donating groups like alkyl groups can increase the basicity, which increases the pKa. But increasing the size of alkyl groups will increase the steric bulk around the nitrogen, which is also known as steric hindrance, which leads to the decrease of basicity of amine. For example, the benzamidine. This is a drug which is used to treat painful and inflammatory conditions of the oral cavity. This is the drug having a amidine group which is connected to a benzene, so it is known as amidinobenzene group. Because of the high basicity of the benzamidine, having a pKa of 11.6 means it is outside the range of 6 to 9, which leads to be too strongly ionized and are poorly absorbed through the cell membrane. So many pharmaceutical companies have invested significant efforts to identify the groups which are less basic and neutral to mimic and try to improve the pharmacokinetic properties of these compounds. So this is a newer compound, and in this compound this amidinobenzene group is replaced by the 2-aminopyridine ring, which is less basic and leading to a decrease of basicity in this newer compound. Now coming to the variation of aromatic substituents to vary the pKa. The pKa of aromatic amine or carboxylic acid can be varied by adding the electron donating or electron withdrawing groups or substituents to the ring. The position of the substituent is important too if the substituent interacts with the ring through resonance. In general, the electron withdrawing group increases acidity as they decrease the pKa, and the electron donating group decreases acidity as they increase the pKa. Now coming to the bioisosteres for the polar groups. Bioisosteres as substituents are substitutes for important functional groups and are required for target interaction but pose pharmacokinetic problems. For example, the carboxylic acid, which is highly polar group and which can be ionized and hinder the absorption of any drug containing this group. To overcome this problem, we must mask it as an ester prodrug, or we can replace it with a bioisostere which has similar physiochemical properties and has advantages over carboxylic acid, such as the 5-substituted triazole ring. This ring contains the acidic proton like carboxylic acid and ionized at pH 7.4. Therefore, the advantage that the tetrazole anion is 10 times more lipophilic than the carboxylate anion and thus better absorbed and also resist many of the metabolic reactions that occur on the carboxylic acid. Coming to the improvement in metabolism. The aim is to make a drug which is more resistant to the chemical and the enzymatic degradation. There are various strategies that can be used to make the drug more resistant to hydrolysis and the drug metabolism. Thus, they prolonged their activity, that is, having their more duration of action, such as steric shield. Some functional groups are more susceptible to chemical and enzymatic degradation than others. For example, esters and amides. The esters and the amides are prone to hydrolysis. A common strategy that is used to protect these groups is to add steric shield. Steric shield designed to hinder the approach of nucleophile on an enzyme to the susceptible group. These usually involve the addition of a bulky alkyl group close to the functional group. For example, the tertiary butyl group in the antirheumatic agent. This tertiary butyl group in this antirheumatic agent serves as a steric shield and blocks the hydrolysis of the terminal peptide bonds. The another example include the methicillin. Methicillin is a penicillin which contains 2 OCH3 group at this ring, and this will protect the attack of the beta-lactamase on this beta-lactam ring. Oxacillin, cloxacillin also have bulky groups, and due to steric hindrance they provide the resistance to the beta-lactamase. Now coming to the electronic effects of the bioisosteres. Another tactic used to protect a labile functional group is to stabilize the group electronically using bioisostere. For example, replacing the methyl group of an ethanolate ester. This methyl group of ethanolate ester with NH2 gives a urethane functional group which is more stable than the original ester. The NH2 group has the same size and valency as the CH3 group, therefore has no steric effect, but it has totally different electronic properties since it can feed electrons to the carbonyl group and stabilizes it from the hydrolysis. For example, the carbachol, which is a cholinergic agonist, and the cefoxetine, which is a cephalosporin, are stabilized in this way. This is the CH3COOR group in the carbachol, and this is the NH2COOR group in the carbachol, and this is the NH2COOR group in the cefoxetine. Now coming to the stereoelectronic modification. Steric hindrance and the electronic stabilization have used together to stabilize labile groups. Example, procane. Procane is an ester which is quickly hydrolyzed, but changing the ester to the less reactive amide group reduces the hydrolysis in the procainamide or to the lidocaine. The presence of 2 orthomethyl, these are the methyl groups. The presence of 2 orthomethyl groups on the aromatic ring in the lidocaine helps to shield the carbonyl group from the attack by the nucleophiles or enzymes. This results in the longer acting local anesthetic. Here, both the steric and the electronic influences are both involved, and these modifications are defined as stereoelectronic. Now coming to the metabolic blockers. Some drugs are metabolized by introducing of polar functional group at a particular positions in their skeleton. For example, the magistrol acetate, which is an oral contraceptive and is oxidized at position 6 to give OH group at this position. By introducing a methyl group at 6th position, this is the position number 6 and we have introduced a methyl group. The introduction of this methyl group will block the metabolism and the activity of the drug is prolonged. Now coming to the removal of the susceptible metabolic groups. Certain chemical groups are particularly susceptible to the metabolic enzymes. Example, the methyl group on the aromatic ring are often oxidized to carboxylic acid, which then quickly eliminated from the body. Other common metabolic reactions include aliphatic and aromatic carbon hydroxylation, nitrogen and sulfur oxidations, oxygen and sulfur dealkylations and deamination. Susceptible group can sometimes be removed, replaced by groups that are stable to oxidation in order to prolong the lifetime of the drug. Example, this methyl group of the drug tolbutamide, which is anti-diabetic drug, was replaced by chlorine atom to give a chlorpropamide, which is much longer lasting, and the replacement of the susceptible ester in the cephalosporins like cephaloridine and cephalexin are another examples. Now coming to the group shift. Removing or replacing a metabolically vulnerable group is feasible if the group concerned is not involved in important binding interaction with the binding site. If the group is important, then we have to use different strategies such as either mask the vulnerable group by using a prodrug or shifting the vulnerable group within the molecular skeleton. By this tactic, salbutamol was developed in 1969 from its analog neurotransmitter, the noradrenaline, which is a catechol structure. Noradrenaline is metabolized by methylation of one of the phenolic group with a catechol O-methyl transferase. The other phenolic group is important for the receptor binding interaction. Removing the OH or replacing it with a methyl group prevents the metabolism but also prevents the hydrogen bonding interaction with the binding site. While moving this vulnerable OH group out from the ring by 1 carbon unit as in the salbutamol make this compound unrecognizable by the metabolic enzyme and also not to the receptor binding site, means it will prolong the action of the salbutamol. Now coming to the ring variation. Certain ring systems are often found to be susceptible to metabolism, and so varying the ring can often improve the metabolic stability. For example, the replacement of the imidazole ring, which is susceptible to the metabolism in the Ticonazole with 1,2,4-triazole ring gives the Fluconazole with improved stability as shown previously. So the imidazole ring, this imidazole ring is replaced by the 1,2,4-triazole ring, which gives the Fluconazole with improved stability. So we can also go for the ring variation. So this is all about the pharmacokinetic parameters which can affect the drug design. If you like this video, please do subscribe my channel and share with your friends. Thank you for your time.